SigTalks, Episode 020, Sigafoose's Pre-Consultation Video. Today's episode is brought to you by Sigafoose Weekly, a new self-consulting program from Sigafoose.com. It's a $75 per month program that gives you everything you need to make massive changes in your practice and in your personal life. The program consists of the Sigafoose Systems Manual with over 200 pages of office growth and procedures, a private Facebook room that is only for people who have subscribed to Sigafoose Weekly, so you have a worldwide network of like-minded people who are philosophy-minded chiropractors. And if that's not enough, you are also getting the weekly consultation call by Dr. James M. Sigafoose himself. You get all of this for $75 per month. So let me ask you this question. What's holding you back? Isn't it time you become the chiropractor you always knew you could be?
Hello, and welcome to SigTalks with your host, Dr. Carrie Sigafoose, your home for the chiropractic philosophy, where we discuss the teachings of Dr. James Sigafoose, from his writings to his talks and his many audio presentations.
Hello, and welcome back to another episode of SigTalks. This week, and for the next 7 weeks, we're going to be covering all of Dr. James Sigafoose's patient education videos. These videos cover everything that needs to be done on first, second, third, fourth, fifth visit, and so on. Even has one that is about maintenance that you play at the end of the patient's care to educate them on the importance of continued chiropractic care. So with that, I'll go ahead and head on over and let Dr. Sigafoose take it from here. See you on the other side.
Welcome to chiropractic. Let me introduce you to something that's unique, that's a science, an art, and a philosophy, and not very well known. And there's people that come in here for years or coming to a chiropractor for years who think they really know what chiropractic is about. I'm afraid that you don't, and I don't mean to put you wrong, but I want you to understand the facts, the truth. The fact of the matter is, we don't duplicate medicine or physiotherapy or osteopathy or massage or any of these other things. That chiropractic is uniquely distinct. And what we do within the spine is look for a bone that's out of place. A bone that's out of place significantly to be squeezing on the brainstem or squeezing on the spinal cord that's going to stop the messages from the brain into the body. If, in fact, the body doesn't receive messages from the brain, you can understand it won't work. It's going to dysfunction. And as it dysfunctions, it creates symptoms. And these symptoms can be headache, shoulder pain, back pain, stomach pain, any one of 1,500 different symptoms, including swelling, buzzing in the ears, etc. All of these things are caused by dysfunction in the body. Now, if the body's dysfunctional, should we do something with drugs or surgery, cut a piece out, or simply drug and stop the body from receiving its messages? Would that be the smart thing to do? That's what most people do. And that's why we have so many people in the hospital. That's why we have so many people dying early. Let's not look at it in that respect. Let's look at it from the viewpoint of chiropractic. In chiropractic, we're not going to treat these things. We're going to locate that bone that's out of place. We're going to correct that if it's correctable. We're going to allow pressure to come off the brainstem and off the spinal cord and let the messages maximally from the brain into the body, giving back the body its power to heal itself of any disease known to man. I don't care what you have, really doesn't make any difference. We're not going to heal it. The body's going to heal itself. But the body can't heal itself if it's restricted. The body can't heal itself if there is messages being cut off because of pressure on the brainstem because a bone is out of place. So our job is to, if you look at this chart, to realize that the brain is here, the spinal cord is here, and that all of these parts of the body are run according to the messages that come from the brain into the body. Our job then is to find that bone, correct it, maintain the correction long enough for the body to replicate or replace tissue cells. And if you don't understand that, let's tell you that the body replaces itself 2.5 million cells per minute. 2.5 million cells coming and going from the food that you eat and the intelligence in your body taking from the food, creating new tissue cells. In this particular instance, what's going to happen is if we free up this bone, if we allow the brain to talk to the body, then the body is going to replicate and recreate normal cells instead of abnormal cells. If it creates enough normal cells versus abnormal cells, that's healing. See, most people think that health is feeling good. I'm here to tell you that that's wrong. That health is having a body that's capable of replacing itself with normal cells versus abnormal cells. And that's what we're here for, and that's what you're here for, hopefully. So what we want to do is examine you, take some pictures, find out what's going on, see where that bone is or how many bones are misaligned or out of place causing pressure. And when we find it and we can correct it, that'll be our objective, to correct that bone or those bones that are out of place. And if you give us the time and cooperate with us, thereby allowing us the time and the effort to get these bones back into alignment and give it the time for the brain to be able to talk to the body and recreate normal cells versus abnormal cells, then you can be in a state of health perhaps you haven't been in God knows when. And you must understand that would be wonderful for the rest of your family, husband, wives, children's mom, dad, etc. If we could do something for the body, with the body, before it became diseased, before it got sick, that'd be far smarter than trying to do something after the fact. So, the doctor will be with you in just a moment.
Hello, and we're back. So, question. Are you educating your patients before, during, and throughout their care? Are you taking the time to not only let your patients know why they are at your office, but also how long they will be with you, and more importantly, what chiropractic is? Over the next few weeks, we will be covering all of Dr. James Sigafoose's patient education series. Did you know that he made a series of videos that not only educate your patients on what chiropractic is, but also covers everything from whiplash to symptoms and why maintenance care is so important? Today's video is entitled Pre-Consultation and is 4 minutes long, but it prepares your patients to meet you for the very first time. This first visit is the most important visit your patient will have, and it sets the groundwork for what will hopefully be a lifetime of care at your practice. Now, if your patient is like most of the patients that come into chiropractors' offices, they are most likely, not always, but most likely there for some sort of backache, pain, or strain. Though we as chiropractors do an excellent job in helping these patients become symptom-free, it is not what we do, and definitely not what we want our patients to think that we do. So wouldn't it be smart to lay the proper groundwork before you ever meet them? Today's video is played after the patient has filled out all their intake information and patient history, and before they meet with the doctor and go over why they are at the office. It literally, in 4 minutes, takes the likely reason they are in your office, that being pain, and starts to educate them on what chiropractic really is. At 38 seconds into the video, Dr. Sigafoose immediately explains to the potential patient that we are not like any other profession. He lets them know that we are not like massage or physical therapy. He lets the patient know that we are looking for a bone out of alignment that is causing pressure on the brainstem that goes from the brain to whatever part of the body that it goes to, and if that bone that is out of alignment is allowed to remain, it will cause dysfunction and not let the body work the way it's supposed to. He then goes directly into explaining to the patient that our job is to find that bone that is out of alignment, and if we can, correct it. He lets the patient know that even though we are expressing symptoms and that we can help with those symptoms, that is not what we do. We are going to find the bone that is out of alignment, decreasing the mental impulse from the brain to the body, and correct it, and allow the body to heal itself. Wow. Now, can you see why it is so important on the very first visit to explain to the patient what we really do? Immediately, Dr. Sigafoose has laid the groundwork to educate your patients on who we are, what we do, and why it is so important that we continue on their journey of discovering what chiropractic is and how it can not just help them, but their entire family. It sounds a whole heck of a lot more fun than just saying, "Hi, I'm a back pain doctor and I'm going to make your back pain go away." Now, can you see the importance of educating your patients from day one? There are 7 videos in this series, and I will be going over a different one each week, in the order in which they should be used in your practice. Next week, we will be going over the X-ray report. If you are interested in having any or all of these videos in your practice, just head on over to sigafoose.com. They are all there, and they are all ready for immediate digital download. We even have a ridiculously low package price if you want all 7 of them, but they are also available individually. Just think about how amazing it would be to have Dr. Sigafoose as a practice member, being there to walk all your patients through every step of their care, all in the exact same way, freeing you up to adjust and field any and all questions that they might have afterward. Not only that, but these videos will help your staff understand even more what it is that we do and why it is we do what we do. That was a lot of do's. With that, I will say good day, and I will see you next week for video number 2, the X-ray report. Until then, remember, it is better to give more than you get. Bye.
Thank you for joining us today. If you're interested in more of Dr. Sigafoose's material, head on over for your daily dose of chiropractic philosophy to www.sigafoose.com and register for our free newsletter and to find today's audio clip of Dr. Sigafoose in its entirety. Remember to give, love, do, and serve.